Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today I've come with an important topic, quadrangular and triangular spaces and axillary nerve, and of course it's applied anatomy. First question, one request to all of you, please sit with some drawing pencils and drawing sheets. So if I ask you to draw, please do draw. Right. Question, what are quadrangular and triangular spaces? Now, these are spaces which are seen in your back and scapular region. Why are we studying them? We are studying them because some important structures pass through those spaces. Sometimes these structures can get compressed in those spaces, so we must know that such spaces exist. Right. So these are muscular spaces, right? So we will study them as structures, muscles forming the boundaries, what are the contents of those spaces, and what is its applied anatomy. I want us to begin this by carrying out an activity. Take your left hand, index and middle finger in this manner. Take your right hand, index and middle finger in this manner and make them pass through in this way. Okay, so you've got these digits. Now come to the screen. The middle finger of your left hand is teres minor. The index finger is teres major. The index finger of right hand is long head of tricep and the middle finger is surgical neck of humerus and the shaft of humerus. This results in creation of three spaces, the quadrangular space 1, upper triangular space 2 and lower triangular space 3. This is the way traditionally students have been studying quadrangular and triangular spaces. It's a very effective method. You should use it too. Right. So quadrangular space. That means I'm going to look for something which is having 4 boundaries. Correct? Fine. So now this is a dissected specimen seen from the front. So this is the humerus, this is the scapula, obviously it's the right side. This is the quadrangular space I am looking for, bound superiorly by lower border of subscapularis, inferiorly by upper border of teres major, medially by long head of triceps, see this whole thing is long head of tricep, and laterally by surgical neck of humerus. This is the quadrangular space seen from the front. Let's turn the specimen over. You can see the axillary nerve and posterior circumflex humeral artery exiting the axilla through this space. Turn the specimen over. Look at it from posteriorly now. Here, posteriorly, the upper boundary of quadrangular space is formed by teres minor and capsule of humerus of shoulder joint. Inferiorly formed by teres major, upper border. Medially formed by long head of tricep and laterally formed by surgical neck of humerus. So here is your quadrangular space. It is through this space that structures will exit axilla and come into the back and scapular region. Right. So the boundaries of quadrangular space we saw were superior, inferior, medial and lateral, 4 boundaries. Superiorly formed by anteriorly subscapularis, posteriorly capsule of shoulder and inferior border of teres minor. Inferiorly it is formed by upper border of teres major. You can always go back to the diagrams again if you are not able to understand this. Medially formed by long head of tricep, laterally formed by surgical neck of humerus. So what are the contents? You already saw there are 2 contents, the axillary nerve and posterior circumflex humeral artery. So let's study the contents. So here, this is the axillary nerve. You can see that it's a branch of posterior quadribrachial plexus with a root value of C5, C6. In the axilla, it is situated posterior to axillary artery and lateral to the radial nerve. That's the radial nerve. It lies lateral to the radial nerve. It exits the axilla by passing through the quadrangular space and appearing in the back. So let's draw this to understand. Are you ready, students? Let's begin. Draw as I have shown you. This is a very unique diagram. Draw it as I am showing you. From C5, C6, this is your axillary nerve. lies posterior to the axillary artery. Have you drawn the axillary artery? Right. Now the axillary artery gives rise to anterior and posterior circumflex humeral arteries which wind around the humerus. Axillary nerve along with posterior circumflex humeral artery exits the axilla passing through the quadrangular space. While in the quadrangular space, it gives rise to a branch that supplies the shoulder joint. Have you drawn the branch? Okay. After appearing now in the back or the scapular region, the axillary nerve divides into an anterior branch and a posterior branch, anterior and posterior to the deltoid muscle. Both anterior branch and posterior branch supply the deltoid muscle. After that they appear on the skin to give cutaneous supply. Anterior branch supplying skin over the lower part of deltoid. Posterior branch giving rise to upper lateral cutaneous nerve of arm. This posterior branch also gives rise to a branch that supplies teres minor. This branch shows presence of formation of a pseudo ganglion. This diagram completely gives you the diagram of axillary nerve and its distribution, its branches, its cutaneous motor supply, everything. Okay, practice it a couple of times. You will never go wrong in axillary nerve. Right. So now here can we see it in gross as well? Yes, you can see the axillary nerve emerging out through the quadrangular fossa. We assume that it has already supplied the capsule. Now it divides the capsule of shoulder joint. Now it divides into an anterior branch and a posterior branch. The posterior branch is also giving rise to a nerve to teres minor with the pseudo ganglion. This is what it will appear like when you dissect on the cadaver. What is the applied importance of axillary nerve? There is a lot of applied importance. Whenever you have a dislocation of the shoulder, the head of the humerus actually compresses the axillary nerve in the quadrangular space. Fractured surgical neck of humerus, again axillary nerve is damaged. Intramuscular injection, sometimes an over-enthusiastic and low-knowledge medical student or medical professional might inject into the deltoid in such a way that they would end up damaging the axillary nerve. A pressure of a badly adjusted crutch. Can you imagine that? Somebody is having a crutch and walking. The crutch itself is compressing the axillary nerve. These are things that are routinely seen. Okay? Let's look at a problem. A patient was brought to the OPD with a history of fall on the shoulder. He is in severe pain, unable to abduct his arm. On examination, he shows loss of cutaneous sensation on his arm as well. He is diagnosed as a case of shoulder dislocation. Question: can you explain why was he unable to abduct his arm? Yes, I can. Because his axillary nerve was damaged at the time of shoulder dislocation, so his deltoid is no longer receiving nerve supply and therefore cannot abduct the arm. Why did he have loss of cutaneous sensation over the arm? Again, because his axillary nerve is damaged, which gives cutaneous supply over the deltoid, and that is why he has cutaneous loss. Remember, students, if untreated, over a period of time, he is going to have a very bony shoulder, as the deltoid will undergo disuse atrophy, and slowly the muscle mass will reduce and the bony prominences will become prominent. He will lose the rounded contour of his shoulder. Students, if you are enjoying this lecture, do please like and subscribe to the channel. Do share your thoughts in the comment section. Right. Let's talk about the next set of spaces, the triangular spaces. There are two of them. Remember, this is the quadrangle in the middle which we have done. So now we need to do upper triangular and the lower triangular space. So, upper triangular space. Upper triangular space is formed by inferior border of teres minor, superior border of teres major, laterally bound by long head of tricep, and the apex is formed where the teres minor and teres major meet on the scapula. This is the upper triangular space through which you can see the circumflex scapular arteries emerging, winding around the scapula. So that's the upper triangular space. What about lower triangular space? Lower triangular space is bound superiorly by lower border of teres major here, medially by longit of tricep, and laterally by shaft of humerus. This is the triangular space called as lower triangular space. Passing through this are two very important structures, the radial nerve and the profunda brachii artery. Let's learn about these contents. Let's talk about radial nerve in the axilla and the forearm region in the posterior part of forearm. Right. So, radial nerve is a direct continuation of brachial plexus having the root value C5, C6, C7, C8 and T1. It is situated posterior to the axillary artery. Now take a look. In the axilla, that's the radial nerve, it gives rise to a branch to the long head, a branch to the medial head, and also gives rise to a posterior cutaneous nerve of arm. All these branches are already given off in the arm, in the axilla. So now you imagine that if the radial nerve is damaged distally, will it lose control of tricep? No, the tricep will continue to function. After giving rise to these two branches, it passes through the triangular space to enter into the spiral groove. In the spiral groove, it supplies a nerve to lateral head, a nerve to medial head, and that nerve also supplies the anconeus muscle. So, three muscles are supplied. It gives rise to two cutaneous nerves. One is the lateral cutaneous nerve of arm, and other is a posterior cutaneous nerve of forearm. Okay. After supplying all this, it pierces the lateral intermuscular septum seen here to come on the anterior aspect of arm. So that's the radial nerve in the arm and the spiral groove. It passes from the axilla into the spiral groove by passing through which triangular space? Lower triangular space. Bound above by teres major, medially by longit of tricep, and laterally by shaft of humerus. Right. We come to the fact that we've been talking about nerves throughout. Arteries are also content, but we've never talked about them. Let's talk about the entire arterial supply up till here in one go. Right. Here you're seeing the axillary artery coming towards the upper limb to supply the upper limb. You know that it divides into three parts by the pectoralis minor. First part giving rise to one branch, second part giving rise to two branches, and the third part giving rise to three branches. What are those three branches? Subscapular artery, anterior and posterior circumflex humeral arteries. After supplying these branches, the axillary artery will continue downwards. The subscapular artery that we just saw gives rise to a circumflex scapular artery that winds around the scapula and comes on its dorsal surface. Remember in which triangle did you see this artery? Yes, you saw it in the upper triangular space. Where did you see posterior circumflex humeral artery? Yes, you saw it in the quadrangular space. Very good. Now here is the brachial artery, continuation of axillary, continuing downwards. As it descends down, it gives rise to its largest branch, the profunda brachii artery. The profunda brachii artery gives rise to a number of branches such as radial collateral, middle collateral, nutrient branch to humerus, and ascending branch to anastomose with the higher arteries. All these are branches of profunda brachii given off in the spiral groove. So, which of these arteries did we come across in the three spaces? We came across posterior circumflex humeral in the quadrangular space, circumflex scapular artery in the upper triangular space, and profunda brachii artery in the lower triangular space. It's very important that all of you understand this basic anatomy of arterial supply to upper limb. So let's revise, students. We're done with this very simple topic. Quadrangular space is a space bound above by teres minor and capsulo-shoulder joint, below by teres major, medially by longit of tricep, laterally by surgical neck of humerus. This is the quadrangular space through which axillary nerve and posterior circumflex humeral artery pass. Now, bound above by teres minor, below by teres major, and laterally by longitud triceps is which space? Upper triangular space, through which the circumflex scapular vessels pass. Again, bound above by teres major, medially by longitud tricep, laterally by shaft of humerus is a triangular space. What passes through it? Radial nerve and profunda brachii artery. What is this triangular space called? Lower triangular space. Very nice. After we did these three spaces, we discussed also the axillary nerve. We know that the axillary nerve has a root value of C5, C6. It passes through the quadrangular space, accompanied by posterior circumflex humeral artery. While in this space, it gives rise to a branch to shoulder joint and then gives rise to an anterior branch and a posterior branch. The anterior and posterior branches both supply deltoid muscle and then go on to supply the skin over the lateral aspect of the arm. The posterior branch also gives rise to a branch that supplies teres minor, which shows a pseudoganglion formation. This is the axillary nerve we discussed. We also discussed its applied anatomy. We also discussed radial nerve in the axilla and in the spiral groove. We also discussed the arteries of the entire region. I would like you to revise that once. And so with this, we complete the very simple topic of quadrangular spaces and triangular spaces and the axillary nerve. Questions are very often asked on this. Write a short note on quadrangular space. Write a note on axillary nerve and explain its applied anatomy. Describe quadrangular and triangular spaces of scapular region. Also, MCQs are involved in this topic, such as which of the pairs is correct? Is quadrangular space paired with radial nerve? No. Is it paired with axillary nerve and circumflex scapular artery? No. Is it paired with triangular space? Is triangular space paired with axillary nerve? No. Is triangular space paired with radial nerve and profunda brachii? Yes. Or surgical neck of humerus is related to the following structure. Which nerve? Radial nerve, axillary nerve, ulnar nerve, medial nerve. Obviously, it's paired with the axillary nerve. So, this is how the topic is simple, very easy to attempt, but unless you study it, you're not going to get full marks for it. So, please go ahead and study this topic well and get your marks. If you enjoyed this lecture, students, do like and subscribe to the channel. It will encourage me to make more of such informative lectures. Thank you, students. I enjoyed taking this class. I hope you enjoyed attending it too. See you across the screen in some other video. Thank you. Bye.